Okay, good morning, students. We are going to continue on and finish out the rest of the lecture PowerPoint for the instruments and materials for your 105 module. All right, so the last time that we were here, we kind of talked about miscellaneous tools. We ended up ending on that tourniquet. So now we're going to get into some large animal specific instruments. So if you've never worked with large animals or in farm medicine, all of these instruments are probably going to be fairly new to you. And I'm gonna, like I said, I have a lot of videos to kind of go along with it so you guys can see in action what we really use these instruments for. So the first instrument here, this is an automatic multi-dose syringe. So we will use this primarily in livestock medicine, especially with like cattle, large herds of cattle, sheep, goat, even swine. And what we can do with this multi-dose syringe is exactly that. We're going to be loading up this syringe and we are going to be loading up multiple of doses, usually up to anywhere between 30 to 50 doses, kind of depending on what you're giving. And then we can vaccinate or give medication to the entire herd. So it's not going to be necessarily the most sterile way to do it, but with livestock medicine, we do kind of have a little bit of gray area and leeway. A lot of farmers will do this on their own. They'll have their own multi-dose syringes and they will just go through and vaccinate their whole herd. It's really common. So what I want to do is show you a video of how they're going to use this multi-dose syringe, as well as, because I noticed that there wasn't any tools on here for like oral medication. And it's really important, especially when giving like oral meds to horses. There's a specific way that we do it. We don't use like that kind of the pill guns that we do in our small animals, and we do have the baling guns that we'll use in our cattle, but we don't use either of those for our horses. So the first video I'm going to show you is giving an oral medication to a horse and kind of the best way to do it. With these horses, I mean, they're really large in size, you know, they're anywhere from 800 to 2,000 pounds. And so we do need to be really gentle and careful when we're giving this medication. A lot of horses too, like once they've had a dewormer, they know what's coming, they know what it looks like. So knowing the correct way that we can approach them without putting ourselves in danger is really, really important. So I want to show you real quick, just oral medications, and then we'll get into a farmer that's going to be giving vaccinations out of that multi-dose syringe.
Hi, I'm Callie from CRK Training, and in today's video, we're going to be going over another basic horse care skill, which is administering a dewormer or any other kind of oral medication. So this is going to be helpful for, again, whether you're needing to give a dewormer, which is what most of you are probably watching for, or if you're having to give some other kind of oral medication to your horse, maybe it's buterbanamine or a probiotic or anything like that. So one of the first things that I want to do, especially if I have a horse that I know might be a little bit difficult with this, one of the things that I've used with Ace is I'll just take it and I'll just kind of touch their nose a little bit. So you saw him tense up because he sees me holding this thing. But if you just spend a minute to kind of pet their nose and rub their nose, it'll kind of help them not be quite so jerky or so jumpy that if you just try to put it in their mouth right away. Just a technique that I found helpful. Another thing I'll do is I'll take my thumb and I'll stick my thumb in his mouth a few times. And that way, when I do go to put the dewormer in, especially again, if it's being difficult and if you have a horse that's really throwing their head up, if you just practice this a few times, or you can even stick the tube of the dewormer in, which you see he's fighting, without actually administering it, it can help get them a little bit better about it and be a little quieter. So when you do actually go to push the medication in, you've got a better shot of actually getting it where it needs to be, because we've all tried to give this stuff and it's ended up everywhere else, which is a waste of your money, and you want the horse to be getting what he's supposed to be getting. So of course with any of these, you've got to dial them up first.
So with these syringes, a lot of the time with dewormers or with oral paste that we're going to give, especially one of the most common ones is known as Banamine. And Banamine is a pain medication that we'll give these patients, especially when they're experiencing colic. And so with that, it's got a little roller on the end of this oral dose syringe, and you'll roll it down right into the point where, it'll cut off. It usually says by pound. So it'll say like a 500-pound dose, 1,000-pound dose. So we'll just want to dial it to that point where we want it to stop, because that little piece of plastic that she's rolling down will then stop the syringe. So you only give the dose that you're wanting to give.
Put it to his weight, take the cap off. Now what I tend to do is I tend to take a hold of the horse's head like this. So I've got a good control of their nose. If you've got a horse that's really easy, you can just hold the halter and do this, but I've just found that I'll do this, especially with a horse that's more difficult. I'm going to put it in, I'm going to try to slip it to the back here, administer it, and then as I do, I'm going to try to bring his head up. And this is just a tip that I found as I bring the head up and I kind of let him swallow a little. The dewormers are designed to kind of be sticky. But I've still found that if I don't do that, sometimes they'll start spitting and they'll spit it all over the place. And I should have mentioned it actually. Another tip for why I put my thumb in and I put the dewormer or the tube in, the medication tube, before I actually administer it, is if they've just been eating and they've got like grass or hay in their mouth, the product, the oral medication, can end up sticking to that and they can end up spitting it all out in big clumps. So if you just kind of stick your finger, you stick the tube in without actually administering it, it makes them spit that stuff out first. And then you've got a better chance of this, again, getting where it needs to be. And he was actually really good for that today. So if you had a horse that was more difficult, you would spend a little bit more time doing like the dry runs, just, rubbing your hand here, putting this in without actually, administering it, putting your thumb in. And again, just, stay here or stay here where you've got good control of the horse's nose. And if they're backing up, if they're doing whatever, use the concepts of timing where you stay with them. And then as they're quiet, step away and give them a release. And then you can come in and do that again. So again, you want them to be as quiet as possible when you go to actually administer whatever you're needing to give them, so that you can get it in there and it stays in there. And then just the little lift of the head helps them swallow and get that in their system before they have a chance to spit it out.
And we'll do that with, dogs and cats too. When we're giving the oral medication through that pill stick or pill gun, we will then hold their head up and kind of massage down their esophagus to get them to swallow. So of course, horses, they're larger. It can be a lot harder to hold their head up. So having them as calm as possible and taking your time. We never want to rush things with these horses. The last thing we want to do is give them a bad experience, because then they're going to usually be bad for the rest of their life. So it all starts with just patience, taking it slow. And as long as they know, they're not going to get hurt and, it'll be over in just a few moments, they're going to do a lot better. So now I want to show you a video of, right, let me get my screen down a little bit here. Oh, come on. Well, the Zoom stuff is popping up around it. There we go. Okay, so now I want to show you guys a video of giving multi-doses with that syringe. And this is going to be using a vaccine. And again, this is going to be for livestock. So I believe this is going to be, for a big cattle herd.
Welcome to the Boehringer Ingelheim Vetmedica Incorporated.
In Boehringer Ingelheim, this is one of the top veterinary medical manufacturers. So they manufacture a lot of our vaccines and materials. They're a really big distribution company for that medical supplies. So they're going to talk about this farmer, and he's going to give this vaccine to his patients. I don't want really to hear too much about that, because I want you guys to see kind of the use of what he's doing. So we'll see his
product cool and protected from extreme temperatures. Also, try to avoid administration when cattle are wet or dirty. Killed virus vaccines are ready to use, so you don't have to mix the product. However,
So with small animals, we have little individual dosed vials for the vaccines. With livestock, it comes in one big vial like this, and then they'll use that multi-dosing syringe to set the amount. It's usually 1 cc of that vaccine that needs to be given. So a little bit different setup than with our small animals.
Gentle shake or rolling motion before use is required to ensure that the adjuvant and the virus particles are distributed evenly. To get started, use one hand to tip the bottle toward you at an angle. Hold the syringe in your other hand and insert the needle into the center of the rubber stopper. Next, move your top hand so it's holding both the syringe and the bottle. Then, use your free hand to slowly pull the plunger back to a little more than your desired dosage amount. Once you've got the proper dose, remove the needle from the bottle. With the needle tipped up, slowly push the plunger until a small amount of vaccine bubbles out of the top. This will ensure that any air left in the syringe or needle is gone. Air in the syringe is dangerous to the animal and may cause inaccurate dosing. Using a multi-dose syringe requires you to set the correct dosage so that each animal receives the proper dosage when the grip is depressed. Before administering your vaccine, make sure that your animal is properly restrained. This will minimize movement and needle breaks during administration. Proper restraint protects the well-being of the animal while it is being vaccinated. Beef Quality Assurance recommends that all injections are given in the neck. When selecting your injection site, you want to stay below the neck ligament. In front.
And it is important to note as well with small animals, so with dogs and cats, we're going to be vaccinating them subcutaneous. Guys, what does a subcutaneous injection mean? These vaccines are going subcutaneous.
Those are just the normal vaccines, right?
Yeah, but what does it mean to give something subcutaneous? Oh, you kind of cut out there, Jenny. I didn't hear all of that. You guys can use the chat too. What does it mean to give an injection subcutaneous? Yeah, it's under the skin. So with our dogs and cats, we're going to be vaccinating them, all of their vaccines besides the Bordetella, which is going to go intranasal or orally. All of the vaccines will go subcutaneously with our small animals. But with large animals, a lot of their vaccines go IM. Guys, what does IM mean if I need to give an IM injection?
Intramuscular.
Exactly. So that's going to go in the muscle. So a lot of the time we're going to be giving the vaccine for these livestock and horses up in their neck muscles, as well as in the gluteus muscles in their hind end. It's a lot safer to do the neck though. So we actually will pinch and then insert into the muscle. And it's going to also depend on the vaccine and where it's manufactured. It's going to tell us where we're going to give it or where we need to give it. But that is pretty standard, is we give it in the muscle for these large animals.
Front of the shoulder and in front and away from the lymph nodes. Make sure the area is clean and clear of debris. Subcutaneous injections are the BQA preferred method of injection. When giving a subcutaneous injection,
so they're going to give this one sub-Q. And again, with horses, a lot of the time it's IM.
Select a new and sterile needle that is between 1/2 and 3/4 of an inch long and is 16 gauge or smaller. After determining the proper injection site, pull the skin on the cow's neck out to create a tent. Slide your needle in at the base of the tent, being sure not to angle toward the muscle or go through the other side of the tent. Press down the plunger on the syringe, going slowly to avoid an influx of air under the skin. Once the plunger is completely down, slowly remove your syringe and release the tented skin. This is a good opportunity to mark vaccinated cattle.
So they use that cattle chute to be able to place their each and every cattle inside, and then they'll give that injection for those patients. And again, the farmers can do this, and a lot of the time they're the ones going to be administering all the vaccines. They'll have antibiotic injections on hand, and usually when they're treating one cow, they'll have them in like a sick pen. But it's pretty traditional. They're not just going to have them on a halter and treat them. These cows are still really, I mean, you know, they have human contact, but they're still pretty feral in that sense. You know, they're pretty squirrely. We'd want them in these cattle chutes in order to medicate them. So, and they'll use that dosing syringe for the whole rest of their herd. They're going to keep using that. So this is just, you know, him washing it out and all of that. So it's not going to be a syringe like with our small animals. We'll just, you know, toss it away. We'll throw it away after a use. With this syringe, they'll actually be cleaning it out and reusing it. All right, so we'll get back into the lecture. So that was talking about that automatic multi-dose syringe, and then also looking at oral medication administration in our horses. Next, I want to talk about some dehorners. So this is a Barnes dehorner, and this is a device that is used to dehorn livestock. Now, this dehorner, it's not as common because it's kind of like a plier. It has a pinching motion here at the bottom, and it can, if used incorrectly, be really detrimental to that patient. They could lose a lot of blood, and it has to be used on a young patient. We don't just want to be using it on these adult patients. Horns, you guys, for the livestock, think about your cattle or your goats and your sheep, the rams, how they're going to have nice, good horns. Those horns, especially when they get to adult stage, they're completely vascular. What does that mean if something is vascular? These horns are vascular. Come on, somebody's got to know vascular. What's vascular? Think of like vaso. Think of like vasoconstriction or vasodilation. When we're talking about vasoconstriction and vasodilation, you guys, that's directly related to the blood pressure. These horns are having active arteries and veins flowing all the way through these horns. So they're vascular, they have blood flow. So that means we can't just dehorn an adult cow, that they'll bleed out. It's not something that's common. If we have to do it for, if it had an injury, we're going to be sedating the cow and cauterizing it. It's going to be a whole medical procedure. So just keep in mind, these horns are extremely vascular. They have veins and arteries running all throughout these horns, whether it's a cow, having long horns or the short horns up front, or our rams that have those big curly horns. So when we dehorn these patients, we're going to do it when they're young. And I mean, a few days old, right? When they're babies, because they haven't started growing yet, they'll still have the patches on their head where the horns are going to grow. And that's ideally where we're going to stop it. So we're going to make sure that like from the beginning, they're not going to develop these horns. And the reason for that, there's many reasons for that, such as having large herds of these livestock. We don't want there to be a possibility of them injuring themselves. They're going to be around, a whole, few hundred group herd of these animals, and we don't want them to be getting into a fight, possibly injuring each other, causing infection, the list goes on. So it's really common to dehorn the patients. Now, again, the Barnes dehorner, not really as commonly used. What we will see more than likely in the field is this electric dehorner. So it's actually like an electrocautery device, which we know that means it's going to be burning off all of those blood vessels and stopping the bleeding. So with this, they can place it right onto where that horn pad is. They can kind of cauterize it and burn it off, and it's going to prevent it from growing. And again, we'll do this when the patients are in their infancy, very young. We don't usually sedate for dehorning, and it kind of depends on the farm because they are so young. But if done incorrectly, and we've got, a patient that is now hemorrhaging and bleeding out, we will definitely have to sedate and, cauterize correctly. So it is something that some farmers do on their own. And it's something that they'll also call veterinarians out to do it because they, don't want to have that possibility of an emergency situation arising. But we commonly see these electric dehorners, very common, and they're a lot safer. All right, so getting into our next instrument here, we have an ear notcher. So we're going to use this with our swine. With our cattle, we're just going to be putting ear tags on them. So these ear notchers, this is going to help us identify the swine, as well as like, which litter they came from, sex they are, individual ear notches, are they going to slaughter? Are they being used for breeding purposes? So forth. So they're going to notch the ears of the swine, again, when they're in infancy. So they're going to be, as soon as they're born, getting an ear notch. And this could also be done right before they're about to leave their mama. So it's going to depend on the farm. It's a lot easier though to do ear notches on baby pigs than, as you can imagine, full-size pigs. So kind of this demonstration picture down here, we have that litter number. So they're going to mark it depending on, which litter it is. You're going to see these pig farmers having a lot of litters at one time. So they might have several locations depending on, where the mama pig came from, what pen they're in, and then individually, again, that's going to be, what are we using them for? Is this going to be a breeding purpose? Is this going to be a patient that will go right into slaughter or raised for that? Is it being sold? So we use the notches more than we will the ear tags with our swine, just because they're more prone to actually rip the ear tags out from each other. They play with each other a lot. They're really nosy. So we'll actually avoid that and do the notches instead. Versus cattle, we do the ear notch tags all the way. All right, so getting into some hoof care here, we have a hoof knife, and this knife is going to be used to help trim the hooves of livestock and animals. We actually use it a lot when we're trimming down the bars, so the inside of the hoof. And it's a fairly sharp blade. It's going to depend too, over time it's going to dull down, so we'll need to sharpen it, keep resharpening it, because the hoof is of a really hard callus material. And in conjunction with the hoof knife, we're also going to use, this is a hoof rasp. And so the farrier is going to use this to trim the hooves of the livestock animals, mainly horses. And this kind of has the same effect as like your nail filer. So it's going to like file down the hooves, make them nice and smooth and pretty before and after placing the shoes on them, or if they're barefoot and they don't need shoes. Yep, and we are going to watch some videos now of some hoof trimming. So I want to show you, first I'll show you a hoof trimming video, and it's important to note that this is not done by veterinarians. Farriers are going to be people that go through like a farrier program. It's usually like a 1 to 2 year school with some externship following. So it's not something where you have to, be a doctor in order to be a farrier. A lot of people, anybody can really go to farrier school to do that. It's really hard work. You're bent over all the time dealing with many different types of horses and livestock. So I envy our farriers. They're amazing. And so this is just going to be a quick video of what it looks like. This farrier is going to see this dirty hoof, and you're just going to see how he's going to start cleaning it out, making it look a lot better. I'm not going to have you guys watch the full thing, but I just want you guys to get the gist of what it's going to look like from the farrier's eyes. And with horses, we are going to be trimming their hooves depending on how often they're used. It's usually every 4 to 6 weeks. It could be every 6 to 8 if they're just in the pasture, they're not doing a whole lot. But if they're working, if they're constantly being used and worked, we'll do it every 4 to 6 weeks. So just like, going to your nail salon, we got to have the farrier come out and trim up their hooves and make them all nice. If their hooves get too long, they can start to trip and not have good gait. So we look at a lot of issues with that when we see those long hooves. And they can also start chipping and breaking, which is something that we don't want either. And farriers, they'll have their own truck or van, and they're going to drive out to that certain site. So they'll come to those farms. You don't have to come to them. They're a mobile service. So this is the little equipment stand that they have over here. You can see their hoof wraps. This is going to be a hoof pick. So they're going to clean out this dirty hoof. This is normal. There's going to be mud and dirt and sand impacted in the hoof because as they walk, it's just naturally going to happen. So we'll clean the hoof out first, and then they'll start to then do their trimming process. And this doesn't hurt the horse, you guys. It's just like trimming off the dead part of your fingernails. That doesn't hurt you. It doesn't hurt to go underneath the nail to clean out the dirt. It's the same concept. This is actually a hoof knife with a hoof pick. This is a pretty cool tool. So he's using that hoof knife, as you can see, to trim down the bars. That nice white hoof underneath. Now he would have to cut really deep in order to get to the meaty part of the hoof that actually has those nerve endings and that's vascular. It's about 2 to 3 inches inside of that hoof. And they do have those natural grooves that go alongside of the frog. This center part here is called the frog, and it is does have more feeling to it. Usually when a horse is sensitive on their feet, it could be a frog injury. So he's getting out all that extra growth in those hooves. And then I want to show you, he's going to move forward to using, he's really going to clean this stuff up. And then this tool wasn't on there, but he's going to use this. Right now he's just lightly was brushing it off. And now this is a trimming tool. So this does kind of look like big pliers. He's going to use this to trim off the edge of that hoof to trim it down. It's just like trimming off the dead part of your nail to trim them shorter. The trimming all the way around, and you can see that it literally just came off as one whole piece. And again, that's just that dead portion of the hoof. Then he's going to grab the hoof rasp here and make it all nice and sanded down to where it's really good and smooth. You can see it's literally like shavings. The hoof is really hard material. Goes right around that hoof, makes it all nice and smooth. So he's going to keep doing that for the entirety of it. They don't show you like a finished product, but as you can see, all the hoof that he's trimmed away, that is successfully a shod of a horse. So when we trim their hoof, we're going to be trimming, and then if we apply new hooves, that's going to be a shod. Now, I do want to show you another video because I know what I said. I said, you know, it's not doctors that trim these hooves, it's farriers, but there actually are some equine doctors that specialize in podiatry, which is the study of the feet or the hooves for the horses. So these veterinarians, they're working out of Rood and Riddle Equine Hospital, and I actually worked at this hospital. I worked with these veterinarians. I did an internship, a 6-month-long internship there quite a few years ago when I was kind of first starting out in the field. And this is all the way out in Lexington, Kentucky, and they are working with racehorses. So that being said, these racehorses, they're worth multi-million dollars. And if they can't run, if they can't race, they're not worth a whole lot anymore. So we have to keep their hooves in immaculate condition. So we can actually do a lot of corrective shoeing and podiatry procedures with these horses. So in this video, they're going to treat what's called a quarter crack. So it's a crack going up the hoof. So we actually will need to patch that. They'll make specialized shoes. These veterinarians, you know, they're going to be actually forging their own shoes. They had their own forge and somebody that would work for them to help custom make shoes for horses. To give you kind of a price point here, a normal farrier coming out to trim your horse's hooves, depending on where you're located, that's going to be anywhere between $80 to $120. And remember, that's every 4 to 6 weeks. But if you are going to a specialist, if you are going to a veterinarian that's a podiatrist, a specialist, you're looking at it being anywhere from $2,000 to $5,000 per session. But reminding you, these are racehorses, which means they have insurance, which means they have great insurance that usually covers the entire cost. They're worth a lot of money, so they're going to be, on really great insurance policies. So again, we're going to watch these amazing doctors here. They're going to do some working with a quarter crack patient with podiatry. This is their forge in the background. They're making those shoes, those custom made shoes.
The Root and Riddle Podiatry Center, we typically travel all throughout the United States and all over the world, treating and consulting on difficult cases. Some of those cases are quarter cracks.
So Dr. Scott Morrison, this is so funny. He's so young in this video. He is such an awesome doctor. He works with podiatry, but he also was internal medicine. He was kind of specialty all over. Really great doctor to work with.
Laminitis, chronic heel pain.
So talking about quarter cracks, cracks up the hoof. Laminitis, that's when the coffin bone actually starts to penetrate through the hoof if there's too much weight on those legs. Chronic heel pain, we know the heel, that's the caudal portion of that hoof. So if there's too much pressure on the heel and it's not balanced throughout that whole hoof, they can start to get really severe heel pain. And we always say the saying, like, the horse is only as good as its hooves, because if the hooves are having issues, if they are not shoed correctly and they're in pain, we're not going to be able to ride them. They're going to be lame, which, as we remember, lameness, that means to be limping. So they're not going to be sound.
All sorts of foot problems. Quarter cracks are seen in all breeds and all disciplines. It's usually a balance issue. You look at the foot from the front, one side's higher than the other. It puts more. So
you can see these hooves are, oh, this one isn't that bad, but this one has a massive indent here, kind of chippy along the side. This could have been due to an abscess or a quarter crack.
Weight on that quarter.
So they do get abscesses in their hooves. So that pus-filled pocket of infection, that can happen in the horse's hooves. And it's really, really painful for them. We have to soak their hooves in like a warm Epsom salt mixture until that abscess comes and bursts through the top or out of the hoof. And then the horse will feel immediate relief. But it is really common.
And that's what causes a quarter crack. Quarter is a very movable part of the horse's hoof capsule. Usually just.
So you can see that was a massive crack that happened right up here at the quarter, and it's grown down. So it'll take them, anywhere between 8 months or 6 months to a year to grow out all the way through.
Generates from the hairline and propagates downward. You can see on this radiograph here, this horse has what we call a negative pump.
So they're going to be taking radiographs of these horses before and after shoeing. With podiatry, again, you guys, they're paying quite a bit of money for these doctors to look at these horses and do these custom corrective shoeing. So they're going to take radiographs. They're going to look at, okay, where is that coffin bone, which is this bone right here? That's the bone that's going to be found within the hoof. Where is it sitting? Where are angles at? Ideally, we want it to be, we don't want a negative palmar angle. This is where we're getting a lot of pressure here on the heel.
Palmar angle. You can see when this coffin bone rocks backwards like this, it shifts all the weight onto the heel region. These horses typically get quarter cracks, sheared heels, all sorts of heel problems on the heel region.
So as you can imagine, if that farrier is not legit, if they didn't go to school, if they didn't have that study, if they're just out there trimming hooves and they don't know about the actual angles and properties of that, what it takes to trim these horses, they could easily mess up it entirely how that horse walks, how they move. They could start having severe hoof issues because of incorrect shoeing.
This should be in the center of the weight-bearing surface of the shoe. You can see this horse is severely out of balance. And here's the same foot after trimming. Now we've established a...
Ooh, so much better. So this is after. They'll take those, again, that pre and post or before and after radiograph images.
Positive palmar degree angle. The coffin joint is now in the center of the weight-bearing surface of the foot. This creates a more shared weight distribution of the toe and heel, and it allows these quarter cracks and sheared heels to resolve. Trimming is probably 80-90% of the formula. Usually, look at most quarter cracks, they pull apart. So usually when we stitch them, it involves some type of suturing to pull the crack bed back together again. And then also a acrylic, we use a fiberglass or use Kevlar fabric patch that goes over the stitching to help cement those wires. This gives it more strength and stability. So you do want to, at some point, stitch and patch the crack.
Just incredible. And again, that's Root and Riddle. Their main hospital is in Lexington, Kentucky. They also have another one up in New York and down in Florida. So they are the equine, those are the horse specialists. They are worldly renowned and known. So if you ever have any interest in horses and all of that, I highly recommend. They still do the paid externship programs. All right, let's get back into it. Okay, so the next instrument we're going to look at here, this is a rectal prolapse ring, and we use this primarily in our swine. Unfortunately, they are really prone to having rectal prolapse, and this can just be due to stress, the environment, after excessive strain, like with the parturition process. So while they're giving birth to the piglets. So what we can do is we can place this device right into their rectum to help that prolapse not become any worse. However, we'll usually need to then be contacting a veterinarian to help reverse this prolapse. This is like a temporary. Sometimes it can correct it depending on how severe the case is. If it's, you catch it really early on, you can insert this piece, stop the prolapse, and actually start to correct it. But if it's, a really severe prolapse, you can insert this tool in order to stop it, from getting any worse, but you would need to then contact a veterinarian to do the corrective procedure that's needed. But unfortunately, it's common in these guys. All right, getting into rumen magnets. So think back to your 101 module talking about rumens or ruminants. Our ruminants, those are going to be our cattle. Goats and sheep also fall into this category. And so we're going to be looking at ruminants. They are, as we know, they have a compartmented stomach. So it's really, unfortunately, it's kind of falsely said, people think, oh, cows, they have 4 different stomachs. No, they don't. They have one stomach that's compartmented into 4 different sections. So they actually digest their food 4 times. So it goes through a really heavy digestion process. With our cows, unfortunately, they will eat and eat and eat things they're not supposed to. So these farmers have to be really careful that in their fields, they're checking for metal and for debris and fencing and clearing out everything, because cattle can mistakenly eat metal and not even really know that they did, just taking mouthfuls of their food and swallowing. So it's really, really common to see that. If a cow does eat metal, we can unfortunately see what's called hardware disease. This is also known as bovine traumatic reticuloperitonitis. So this is when the metal will get stuck into their stomach and start to cause like metal poisoning. So what we can do to prevent the metal moving any further from the rumen is we're going to be giving our patients magnets, and we'll use that baling gun, that oral basically medication administration tool that we use for the large animals. It looks just like the pill gun, but for our cattle. And so we'll load up a magnet in there. This is just a few different examples of what the magnet can look like. And we are going to give this magnet to our patient, and the magnet will actually settle in the reticulum. And that's just one of the sections of that rumen stomach. And so while the patient is eating food, if they do ingest any metal, it's actually going to then attract this magnet, stick to the magnet, and it's going to prevent the metal from penetrating and irritating the lining of the reticulum and going any further in that digestion process. So we commonly see this, especially with like beef cattle, where they're going to have them on a lot of feed, a lot of grass, because they're raising them for slaughter. So common to see these rumen magnets. The next instrument we're going to touch on, this is a tattooing instrument. So we'll use this in livestock medicine, usually with, even rabbits will actually tattoo. And I know that they're more of a smaller pocket pet, but you can actually raise and sell meat rabbits. So rabbits are considered part of livestock. So with these animals, if they don't have ear tags or ear notches, we will give them an ear tattoo. And it's going to be kind of farm preference. Every farmer likes a different thing. So with this, they'll actually place ink in the in the tattooing instrument, and then they will select these little plastic lettering tools that have those metal spikes. You can take them out, put different ones in according to like numbers. So if you're trying to number every single, for example, like every single rabbit, you know, you want to number each one so that you can keep track of who it is and what their intended use is for. So we can swap out these numbers here, and then it's just a singular punch. It's just like a, you know, a tattoo needle going in, and then it comes right out, and it just leaves little black dots. As you can see, there's little dots going around like for the 0 to 5. And that'll number that patient moving forward. And this is permanent. It's just like getting a tattoo. It's not going to go away. It can turn color over time. It can actually turn to like a blue and lighter in tone, but just another way to tag the livestock. Okay, getting into a trocar and cannula, and I'm going to show you guys a video for this. So a trocar and cannula, we're going to use this in cattle to reduce bloat. Now, bloat, we can commonly see that, unfortunately, in our dogs. Bloat is when there is going to be a blockage, or it could be when the stomach adheres from the stomach wall and twists over on itself, which is called a torsion. We see that more in dogs. In cattle, it's usually because their stomach is just so different. They are ruminants versus our dogs and cats are going to be monogastric. So their components and their anatomy of their stomach is varying. So with ruminants, we can see they produce a lot of gas during that rumination process, that digestion process. And sometimes there can be blockages or twisting to where that gas is unable to be released. So as you can imagine, think of like a balloon filling up. That's going to apply a lot of pressure. It's going to be very painful. And if it ruptures, this patient is more than likely not going to make it. So with this trocar and cannula, instead of just going right into a surgery like we would, or a gastropexy, like we would with our dogs to correct and flip over that stomach and then adhere it to the stomach lining wall, we are going to use a trocar and cannula instead. This is like the first line of defense for these cows. So the veterinarian will actually insert the end of this trocar shaft. It's going to be similar to like a catheter, how an IV catheter has that plastic layer outside of the stylet. And when we insert it, then it's just that, plastic that's inside the arm. It's not that needle. So it's really similar, but they're going to do that right into the rumen. So right into their stomach. And they're going to do that to help release all of the gas that's in there. And hopefully it'll resolve the problem completely. If the problem doesn't resolve, they might have to tube the patient with mineral oil or try other methods of treatment. But I want to give you guys a visual of what it's going to look like if the veterinarian has to use a trocar and cannula. And I'm actually going to show you a video of Dr. Pohl. I love Dr. Pohl. You can find the videos there's quite a few different veterinarians that are on the Discovery Channel or Nat Geo. And they actually are accessible via Disney Plus. If you have Disney Plus, you can binge watch all of these awesome veterinarian shows. So I'm going to show you, again, Dr. Pohl going out there and relieving a bovine of this bloat using that trocar and cannula.
Hello, puppies. Dr. Emily has been called out to Chris's farm for a ballooning bovine emergency.
I'm coming out to Chris because he has a calf that's bloating and it needs help immediately.
How are you?
Ready to debloat a calf.
Yeah, I have a calf that's bloated, off feed. You can just see it's like an egg turned sideways in her gut.
Look at how huge this bloat is. This is massive. This poor baby.
Well, he is bloated.
Bloating is caused when foam builds up on top of fermenting food in the stomach or rumen. Come on, buddy. Essentially blocking the release of gas.
Can he sit?
He'll fit. It's very painful for cows and can kill them in as little as 15 minutes.
With bloat, basically the rumen just keeps getting bigger and bigger with gas. And as it gets bigger, it actually starts crushing the lungs and they can't breathe anymore and then they can die. That's some bloat. He looks like a blueberry. This is easily the biggest bloat I've ever seen. So he's enormous. He's as big around as he is tall. Got a little runny nose.
You want
Has
to
he
rate?
got pneumonia?
I don't know.
He has mucus and snot coming out of his nose.
Dr. Emily spots another issue.
Yeah, he's got pretty rough sounding lungs. 103, 5, pretty warm, especially for a cold night. So between the fever and the harsh sounding lungs and the mucus coming out, it looks like pneumonia.
On top of the bloat, this cow is suffering from pneumonia.
Okay,
Time for Dr. Emily to try to provide some relief.
that's a good place. We have to get the air out. Most long-term way to do it is to put a trocar in it, which is basically a really huge hollow needle that allows the gas to come out, and it's screwed into the animal's hide so it can't come out. I make an incision into the skin because otherwise you're not going to get through it.
I just had back surgery, so if this goes wrong, I'm out of here.
That's fair. It's fair. And then you just poke it straight through the muscle walls, the rumen wall, and then start screwing. Okay, you ready?
Yep.
A little pain for a
And
lot.
I want you to listen to this, you guys. She's going to unscrew the trocar and cannula and remove the sharp stylet. And then you're going to actually hear that huge release of gas.
Out of gain.
That'll work. When she got in there, boy, the old gas just come right out.
That should be some relief there, bud.
You can just hear it just whistling
You can
out of
tell he's
there.
feeling better.
Issue 1 is relieved.
And think of, that's going to be as painful as getting a piercing done. It's going to be a quick, sharp feeling of pain, but then that cow is going to feel such an immense amount of relief because that gas is now getting, has a hole to escape from that rumen, that they're not even going to really care or pay attention to that one, poke. They're going to be more focused on the feeling of relief they're going to feel.
How much do you think he weighs?
I was guessing 600.
Next, a dose of antibiotics should help fight issue 2, the nagging pneumonia.
All right, let's see what he does.
Good to go.
Yep.
Again, using these cattle chutes to treat those patients. We're not just going to treat cattle standing next to us on a halter like we would a horse, always putting them in the chute.
Once everything goes down, then he will take the trocar out in like a week or so, and then it'll just heal back on its own.
So that trocar can stay in that patient for, like she was saying, up to a week to help with that gas release. If that patient persists to have problems, they might have to do further, diagnostics and procedures, but usually that's enough to resolve it. So he'll have that right just on the side of his abdomen.
Did an excellent job. Wait and see.
Gotta be feeling better. All right. Is that all you got?
Unless you want to do herd health while you're here.
Sure.
All right, so just to give you guys a visual of using that trocar and cannula, you only got a few more slides left, you guys. Okay, now I want to get into last few slides here talking about just general miscellaneous tools used in the veterinary practice, just ones that we just didn't go over. One of the most common and emergency type tools is going to be this ambu bag. Now, they use something similar with humans, absolutely, when trying to get breaths, whether that's CPR or recovering from anesthesia. So we'll use this the same way we will with animals. It's going to be, this is a handheld device, so we can either put a mask on it, or we can connect this directly to an endotracheal tube. So that tube that goes down the trachea for that airway for the surgery, we can connect this end directly to that and give them manual breaths if we need to, or using a mask like so. And so this is just going to help us, one, provide oxygen, but then also ventilation for that patient and help them with that breathing process. It's most commonly seen during CPR or recovering your patient from anesthesia. So I want to show you a video just real quick of the just using of that ambu bag.
Hey, Bobby Aldridge, March 28th, 2017, finishing up skill 19 with our ambu bag that we got Okay, so this patient is being
So they're going to connect it to their endotracheal tube. And this kitty cat just had a procedure. So they're just going to use this to help give breaths after the procedure to help them wake up.
today, so she is under the influence of catmidazolam and just a little bit of gas right now. So to back us up a little bit, talking about CPR, so what would already have occurred is someone would be doing chest compressions. We've established an airway. So now what we would do is while the compressions are still going, we want to provide ventilation. So your endotracheal tube is going to hook here. Just want to slide it in like that, and then you can be given ventilations. For this patient, she would want to get anywhere between 8 and 12 breaths per minute. You don't want to do too fast because you can cause some serious neurological damage to the patient, but you also want to make sure that you're breathing adequately enough for resuscitation. So you just want to give the bag a light squeeze. You want to make sure that it fully decompresses before you squeeze it again, and you can see the chest moving up and down.
And it's really important to keep in mind, what is the normal respiratory rate for these patients? So we're going to be giving, our kitty cats, it's going to be anywhere between, 20 to 56. So you'd want to give a breath, every 2 to 3 seconds. With our dogs, we can, lengthen that more like 4 to 5 seconds. Their respiratory rate is going to be a little bit lower. But most important thing is that we're letting that bag completely, after we are giving that breath, let it completely decompress, come back to normal before we're giving another one. Alrighty, now this is a common just piece of equipment that a lot of pet owners use. This is going to be that gravity feeder, which is on the left-hand side, or the J tube, which is on the right-hand side. So this gravity feeder, we'll use this a lot with livestock. So talking about our cattle, our swine, even goats and sheep, and they can put the hay or grain material up here up top. And it's going to slowly, as they eat out of the bottom, it'll keep refilling itself. Gravity works. Versus the one here on the right-hand side, this is filled with kibble. So this is going to be for like our dogs and cats. This is like if a patient was free fed. I'm not a big fan of these ones because the kibble can go stale, and it's also giving like a massive amount of kibble for access for those patients. So not really a big fan of these. I like the ones that fill with water because they can keep the water flow good for that patient. But seeing these on the farm, it's very, very common. Usually you don't separate livestock and swine for feeding. You're going to just feed the whole herd together. So you'll have a whole rows of these feeders like that. And then once that patient is done eating, they'll go off and go lay down. More can come up and still get adequately fed. All right, last slide for today. Just touching again on some radiology protective, personal protective equipment, so our PPE. When in radiology, the staff will need to be wearing a lead apron, as shown. You can also be wearing lead gloves, especially if your fingers are near the beam. They have a thyroid collar on, so this is just a lead collar that'll go right along your thyroid area to protect that. And then if needed, they have a sandbag next to them that they can use to prop the patient up against, or that V trough if you're doing that, patient being in the DV or the VD, which is that ventrodorsal recumbency. So on their back, and the beam is going to go through the ventral to the dorsal side. So to use that trough can help make the patient a little bit more comfortable, and it won't impede those x-rays. Or we can use big sandbags to place next to them to keep them in position. As well as you're always going to have 2 people, minimum of 2 people taking x-rays. This individual also has some goggles on as well. It's not mandatory, but it is something that is coming, more common nowadays, just to have that extra layer of protection. And this little badge that you can see here, that's the dosimeter badge. So each staff member will have a badge that is specifically made for them. It'll have your name on it. And it's going to be sent in to usually the company that manufactures the x-ray machine will also take care of these dosimeter badges. So they'll get sent in, every 3 to 4 months, and the practice will get a report back saying how much radiation you were exposed to. And there is a legal amount that you're allowed to be exposed to. So if you're always taking x-rays and your report comes back high, you could be taken off x-rays for the rest of the year. We can't overexpose people. Even though we're wearing this protective equipment, we don't want to be taking an excessive amount. It should be spread up between all staff members when taking x-rays. All right, and that's going to be the end of that instruments and materials PowerPoint for the 105 module.